Abbot.
Well, Omicron is the new variant in town. We are under Plan B measures at the moment. To talk about this, Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter Medical School, with over 20 years' experience in communicable disease control and infectious disease management. Just the very chap to talk us through this. Dr. Bharat.
Hello, good evening.
Plan B, is it going to stop it?
No, and I feel so disappointed because Prime Minister Johnson has once again got it wrong, and it really is frustrating and disappointing. And let me explain why I feel he's got it wrong. He is focusing on one item only, boosters. Of course, boosters are good. Of course, boosters will do the job. But there are other things he could have done ages ago and should be mentioning even now at the 11th hour, 59th minute, which is stay at home, cancel the parties, wear a mask, wear a good quality mask, wear it properly. All those measures are equally important and relevant.
Okay. On the subject of masks, I keep reading differences of opinion. Some experts say, as you had just done, which seems reasonable. Others say, well, it's not entirely decided whether it is actually efficacious.
Yes, I hear you, and I hear all the members of the public who raise similar concerns. And look, empirically speaking, SARS-CoV-2 virus is aerosol spread. If we can stop and capture that aerosol in our masks, we are covering our nose and mouth, then it has a significant impact in reducing the amount of aerosol. Because whilst the mask may not be airtight, if you are reducing it from, say, 100 million particles to 100,000 particles, that in itself gives you empirical evidence that it works. Furthermore, there are now many studies that have been done in reputable peer-reviewed journals saying the same thing, that the masks which capture these droplets reduce the infection by a big margin.
Now, from your point of view, if people wore a mask and they washed their hands and as much as they could, they stopped being close to other people, can they still, with a degree of safety, go to the theatre, go to the cinema, go to football matches and so on?
That's a really good question. And I wish our government, our Prime Minister had promoted all these primary infection control measures. So if we had got into the habit of doing exactly those things you mentioned, we would A, be in a better place, B, the virus in the environment would be in a smaller amount, and C, yes, we could go to all those things that we would like to do, football matches, theatres, etc. And people often accuse the health people like myself for saying we're miserable and we want to lock people up. Certainly not. We don't want to do that. And I say repeatedly, sort out health and you sort out economy at the same time, simultaneously. We should be doing the multi-pronged approach to infection control rather than just the one item, boosters.
Now, people have described how infectious this new variant is. I mean, they've talked about it increasing in the number by 50% a day, which means that, surely, pretty soon, regardless of what we do, we're all going to get it. Would it perhaps be conceivably better to get it over with and then be through the other side rather than just to prolong it?
No, never do that. And I'm very confident in saying that to you in an emphatic manner. No, never do that. And my reasons are as follows. If you allow this pulse of infection to go through, I admit most people may not become ill. Most people are definitely not going to end up in hospital, etc. However, let's take an example. So you say you have 1 million people across whom the infection just goes through, and 0.5% of them may become seriously ill and end up in hospital. Well, 0.5% of a million people is a lot of people. And if this Omicron variant is so infectious that the gradient, i.e. it's a steep, big pulse of suddenly generating a million cases, of which 0.5% need hospital management, treatment, intervention, then that could overwhelm the system. So we never want this very infectious agent to go through the population. And I go back to my original assertion, and therefore reduce your person-to-person activities, your parties, wear your mask, wear a high-quality mask, wear it properly, emphasize that you must wear your mask properly.
Right. Some people are talking about it almost as though we're back to where we started, practically 2 years ago. Is there any way of looking at it in the opposite way, that viruses, correct me if I get this wrong, which is probably likely, but viruses do mutate to become easier to catch but milder in their effect? Is that right?
That is true, but not always the case. So, for example, take the measles virus. It's been around for thousands of years. It hasn't mutated to become a milder, more innocuous virus. So some do, some don't. The big issue is that there are too many unknowns about Omicron, the variant, in an older aged population. And therefore, the caution is don't get infected until we know more about it. And what we can do is, of course, have the boosters, but have the other measures in place at the same time.
And what scenario could you envisage that would mean that we were at the end of all this mess?
Well, when we either have the variant changing to become a dominant one, and it is not disease causing, brilliant. But we won't get there for some time. And again, my reasons are, whilst the West and North America, Canada are heavily immunized, and therefore they have a well-protected population, Africa is not even off the starting blocks with their vaccines. And therefore, that is the place where variants of concern can carry on arising. So there's homework to do, which is, yes, give your boosters, but yes, at the same time, help Africa to set up its immunization program and get going as fast as you can. We can do both. We have to do both.
And what do you think of the West's reluctance to release the recipe? I know that's not the right word, but the recipe for the vaccines that we've got to the third world? Because there seems to be some resistance, doesn't there?
There is, and it is shameful because remember, these pharmaceutical companies who are holding on to their patents were publicly funded in order to invent the vaccines, and we mustn't let them forget this. And it really is wonderful that President Joe Biden came into office and immediately said we need to relax the patent laws and intellectual property rights on the pandemic vaccines. That is a great way forward. And even if the European nations and Australia do not want to relinquish the patents, at least set up plants in Africa under license to manufacture the vaccines at pace.
And it's true, is it, that until the world gets vaccinated and boosted, then this could happen again, and it might be even more serious next time around?
Indeed. And you see, the fundamentals of infection control are simple. It's not super rocket science. So what we should have done, what was in the plans, but we didn't do, is this. You start immunizing the whole world simultaneously. So you start bringing down the number of unimmunized people all over the world at the same time. That way, we will eventually reach a point where variants of concern are not arising from Africa or elsewhere and putting us back. So with Omicron, for example, it has put us back. Whereas if we had even given Africa 30%, 40%, 50% of the vaccines, i.e. improved their uptake to 50%, then the chances of variants keep on decreasing the more people that you immunize. And that was in the plans, except we didn't do it.
Just finally, is there a scintilla of good news that you can leave us with?
Of course there is. There is a lot of good news. We've invented these vaccines, and we've also got quite a few therapeutics coming on the market. That's antivirals and what we call monoclonal antibodies. So they're also coming and they will help. And finally, one good news for 2022 is other platforms of vaccines are also coming along. So whilst Pfizer, Moderna, AstraZeneca may not be able to supply Africa just yet, there are other vaccines from India and elsewhere coming online, which will be able to help with the vaccination program in poorer parts of the world. There's a lot of good news.
Good to talk to you. Thank you so much for your time.
Thank you.
Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter Medical School. You're listening to LBC. I'm Nick Abbot.